I'd like to look at some pharmacology math and a little bit about the different ways that medications are supplied so that we can get a better understanding of how to calculate those, how to know when we've got more or less of something, and why it's important that we understand the different types of the ways that medications are supplied. So this is an overview of those, and then we'll look at each one a little bit closer and give some examples. Milligrams per milliliter. Here, this is really straightforward, and it's almost like, when you're looking at a tablet, how many milligrams per tablet you take. Since we're looking at liquid meds instead of solid meds here, we put the milligrams into a liquid formation. And so when you're talking about milligrams per milliliter, of course, the more the milligrams per milliliter, the stronger that's going to be. And then we're going to look at ratio. Ratio is for highly diluted or highly concentrated drugs. And so with that, we're going to be diluting a milliliter of the concentrated drug in 1,000 milliliters of diluent. Thus, the ratio of 1 to 1,000 being 1 of the concentrated drug and 1,000 milliliters of diluent. Units, we have some drugs that come in units. In particular, heparin we use a lot in surgery, and it comes in units per ml. The good thing about this is, here again, it's kind of like milligrams per ml. The higher number of the units, the stronger it is. The negative thing is there's a wide range of these. So you can have a milliliter of heparin that includes 10 units per ml all the way up to like 20,000 units per ml. So it's definitely a wide variety of two things that look very similar. And then percentages, we use percentages a lot with our local anesthetics. And these are easier to discuss as a percentage versus how many milligrams that we're injecting. And essentially a 1% is 10 milligrams per milliliter, but we're not really going to look at it that way. We want something that's stronger, we would go with the 2% injection. If we wanted something weaker, we'd go with a 0.5% injection. And in those cases, we need to know how much or the number of milliliters injected in order to know the final dose. Otherwise, we would not know what the dose was. All right, let's look at each of these a little bit closer. Milligrams per milliliter, stronger will be more milligrams. So example, 10 milligrams per milliliter equals 10 milligrams weight of the drug mixed in each of the millimeter of the solution or solute diluent. All right, some kind of common examples here. If we were looking at milligrams, as far as a tablet form, then it's really easy. Like here, we've got some 200 milligram tablets here at the bottom. And so if we took one of those, it's 200 milligrams. If we took all four, it's 800 milligrams. Or we might have an 800 milligram tablet. So that'd be equivalent to 4 of those, or you could take half of it. It'd be equivalent to 2 of the 200 milligram tablets. This at the top is a 1,000 milligram tablet. And also in this cup is 1,000 milligrams. In the other cup, we've got 10 milliliters of saline to dilute that 1,000 milligrams. And so I'm going to do that. I'm going to mix this 1,000 milligrams into that 10 milliliters. So to be 1,000 milligrams in 10 milliliters, which end up being 100 milligrams per milliliter. All right, so I mixed those together and drew it up in a syringe. So you see I've got the 1,000 milligrams in 10 milliliters of diluent, or 100 milligrams per milliliter. So for each one of these, that would be 100 milligrams. So that we wanted to give an equivalent to 800 milligrams, then we would only draw up 8 milliliters. So 8 milliliters of 100 milligrams per milliliter is going to be equivalent to 800 milligrams. So these two are equivalent. We've got 800 milligrams in the syringe, and we've got an 800 milligram tablet. So if we wanted to do only 200 milligrams, of course, like here on the right, we've got 2 milliliters of 100 milligrams per milliliter, equivalent to 200 milligrams, or the same as one of these 200 milligram tablets. All right, next let's look at units. Like I said, this is going to be kind of like the milligrams per milliliter, but their units are just a unit of effectiveness. So these units can very much be very small. They could be a lot of units. Typically, what we see is a high number of units per milliliter in most of our stuff that comes measured in units. Definitely size of the unit, which is not something you're necessarily going to see, but knowing that we can put a lot in each milliliter. So we want to remember, though, stronger equals higher number of units per milliliter, and then just always be super careful when we're working with something like heparin, which it comes in units and can vary so much. So we could have something on our back table, that is 10 units per ml, and then have 100 units per ml or 1,000 units per ml right there together, and it all looks the same. And so we have to keep up with that carefully. Some of our antibiotics are also mixed or measured in units. We will also see the international units I didn't mention up here, but that's more seen with their vitamins or in international units. All right, so here we go. I've got 10,000 units in this cup here. I'm going to call it cup A. And 1,000 units in cup B. So then we're going to take that and mix each of those in 100 milliliters of saline. So in cup A here, we have 10,000 units, 100 milliliters of saline. So that equals then 100 units per ml. Here in cup B, we put the 1,000 units in cup B. So we've got 1,000 units, 100 milliliters of saline. So that works out for cup B to be 10 units per ml. And this is just for visual, this is pretend, but you can definitely see that there is a difference in the strength of these two. That the 100 units per ml is definitely much stronger than the 10 units per ml. I guess you could even say it's 10 times stronger, but well, it really is. But so that does go without saying. But you can see this gives you a visual what we mean by the differences. So you can imagine if this made this much difference here, if we put 10,000 units into this same amount, of how much more concentrated that would be. All right, a couple ways that we use units. Example here, heparin. This is 5,000 units per ml, and it is in a 10 ml bottle. And so a lot of times we want to mix 500 milliliters of heparinized saline on our back table when we're doing vascular procedures. So here we've got 500 milliliters. and we take 5 milliliters, 1 milliliter of this 5,000 units, so that'd be 5,000 units of heparin. If we take that and put it into this saline, that will then become 10 units per milliliter of heparin. And that's what we commonly use for intraarterial irrigation, intravascular irrigation from the back table. Now this is bacitracin. This is 50,000 units of bacitracin. And so typically what we're going to do is open a syringe to the back table, 10 milliliter syringe, have the scrub fill it, hand it back off to the circulator that would use that to reconstitute this 50,000 units, spray that 10 milliliters back in here, so then you've got 50,000 units of bacitracin in your 1 liter of irrigation. And I'd mentioned, one of the big things we have to really be careful with when it comes to heparin is how big of a difference it makes between different concentrations, yet they're going to look look the same. So what we normally use, large amounts of for flushing vascular catheters, access lines, and used for intravascular irrigation in peripheral vascular and cardiothoracic procedures is 10 units per ml. But sitting right here next to it is 10,000 units per ml. So these two vials are powerfully different. 10,000 units given, you're going to give 15,000 units to an adult patient to systemically anticoagulate their whole body. So if they're about to have as an adult and they're about to have a vascular procedure, then anesthesia may give, 10,000 units, 15,000 units IV to the patient prior to when we're going to cross clamp a vessel. So this keeps them from coagulating while we're working on vascular structures in their body. But that's a huge dose otherwise. So you would not give this to a person except in a very controlled environment. And it is a short duration for heparin. So when we do that surgically, we can watch it. It's reversible, so it's not that big of a problem. But it's not something you'd want to give a patient without knowing it. So the 10 units per ml you can use in other clinical areas to flush in a central line or something like that. But there has to be great caution that these are not confused. And so that is an issue that has been a major drug error in the past in units or in areas where they use these or would use this 10 units per ml, but should never have had the 10,000 units per ml. All right, but to make a long story longer, the ideal that I want you to get is there's very big difference here. So we're going to be using some of the stronger, but diluting it in a lot of saline, and we're essentially on our back table. Most of the time we're going to have the 10 units per ml, but we're just going to have a lot of it. So we might have to mix 5,000 units of more concentrated heparin in 500 milliliters of saline, so that we've got a plenty of this. But we do have to be careful in knowing what we've got and how we've diluted it so that we know that we're using the 10 units per ml. Sometimes we'll have doctors that want 10 units per ml and 100 units per ml. And so they'll mainly use the 10 units per ml, but at the end of the case, inject a small amount of the 100 units per ml through a central line or a portacath, something along that lines. Now I think it's worth note here again, to make a long story longer, this image of these two side by side is easy to find on the internet. because there's been several famous cases, one of which was very famous because it had some actor and actresses, children involved in it, but in a neonatal intensive care where they were supposed to have on their drug card only 10 units per ml, but it was accidentally stocked with the 10,000 units per ml. Well, the 10 units per ml would be used to flush a central line or to flush an umbilical cord line when the baby, the neonate's first born, they're preemie. Sometimes they'll put a central access line into the umbilical cord for the first couple of days, and then it can no longer be used and they need a regular vascular access. But they can flush those with 10 units per ml. Never, never, never would you flush with 10,000 units per ml, as that would be just a gross amount of heparin to be used on a newborn, in particular one that's a preemie. And so that did occur or has occurred a couple of times, but one time a little bit more famously, like I said, because it involved people that were known, and it did result in the death of a number of those babies as they were so anticoagulated that they bled out. So something that's very serious, but an example of how medication errors you can have two medications that look a lot alike, and that an error can be a big error, though, if not carefully identifying every single time the medication. All right, percentages, like I said, we use this a lot for locals. And our local anesthetics, lidocaine being the one that we most commonly use. We commonly use in a 0.5%, 1%, or 2%. Now we do also use bupivacaine, and it comes in 0.25% and a 0.5% most commonly. When you're injecting local, the doctor's going to want kind of a standard, and for most simple excisions, they're going to inject with a 1% lidocaine. If it's oral surgery, they're going to want a little bit stronger, so they're going to go with the 2%. And so they're really looking just at the strength, and then they kind of judge how much they need to inject by injecting enough to get localization of that tissue, to get numbness of that tissue, to get to that effective point. So they're not looking to inject a certain number of milligrams. They're looking to inject 1% lidocaine until it's sufficient to localize the tissue. So in that case, they're going to inject what they need until it's numb, within limitations. But these can be toxic at larger amounts per hour. So we definitely want to keep up with our total dose, which means that we have to know how much was injected. And so the person in the scrub role is going to be the one that is passing that medication to the physician, and the one that will report then to the circulator how much was injected. Now, 1% can be translated to milligrams per milliliter. And what it comes out to is 10 milligrams per milliliter is equal to 1%. And 100% would mean that it was fully concentrated. Well, you're never going to have 100% because there's not going to be any liquid left there. It's as much liquid as it is medication. But that would be 100 grams per 100 milliliters, or essentially 1 gram per milliliter. Now, I've always mentioned in class that the 1-to-1 ratio of 1 milliliter of water takes up 1 cubic centimeter, and also weighs 1 gram weight-wise. And so in this scenario, you've got 1 gram of medication per each milliliter, And so you've got an equivalent weight of water and medication. So that's a fully 100% concentrated. Now, I did also put centigrams in here, which is something we never really use. But I think since it's done in hundreds, that it makes it look a little bit more. So your 100% would be 100 centigrams per milliliter. 1% is 1 centigram per milliliter. 2% would be 2 centigrams per milliliter. And so it's just easier to see where the hundreds comes in by looking at it that route. But it is 10 milligrams per milliliter. There again, we're not going to necessarily inject a certain milligrams. We just need to know how much 1% or how much 2% or how much 0.5% was injected, so then that it can be figured out what the total dose was. All right, some pictures of the different solutions. Like I said, lidocaine is what we use the most. Now, we often use lidocaine with epinephrine. So you see the vial in the red. This is a 1% lidocaine with 1 to 100,000 epinephrine. And we're about to talk about the ratios that are used to discuss the concentration of epinephrine. Here I just wanted to put the picture so that you could see that the ones that come with epinephrine, that's usually written in red. So you can get local both plain and with epi. We like the with epi in many places as it helps to reduce the bleeding in the area. It's a vasoconstrictor. And so that reduces how much bleeding we have during the procedure. If we're doing like a local little excision of a skin cancer or something like that. But it also helps the local to last longer because you've reduced the vascularity to that area. It's not carried off and metabolized as fast. All right, so final one here, ratio. Ratio, we're looking at that 1 milliliter of a super concentrated drug, and that is diluted by 1,000 milliliters. So it's the first number is the drug, second number is the diluent. And so we're usually going to be looking at this as 1 milliliter of the drug or 1 of the drug, and then how much it's diluted. We're not going to be looking at weird ratios here. It's always going to be the 1 to whatever the second number is. So with this, the more or the larger the second number, which is the diluent, the weaker that first number is. So because we're diluting it in a bigger amount of diluent, then it's going to be weaker. So our 1's going to stay the same, but then we're going to increase this second number, making it less concentrated. Now, for these, it's important that we remember too that 1 to 1,000 can also be written as 1 over 1,000. So if we're thinking about 1 to 100,000, let me write it up here where we've got a little more space. 1 to 100,000, then that is equivalent to 1 over 100,000. And so since that first number, that top number is divided by the bottom number, we have the same top number, much bigger bottom number. This is going to be much weaker, a much smaller fraction. So this is 100 times smaller than this one on the bottom here, or 1 to 1,000. So let's look at it kind of as an example, and we're going to use right here a fake or pretend epinephrine. And so here we've got 1 milliliter of super concentrated. I'm talking about this is only at the medication in the pharmaceutical processing plant. Would they ever even touch this stuff? We'll never see this in in the hospital setting This is something only for those chemists to be able to dilute this into something we can use at the hospital. But here we've got 1 milliliter of super concentrated 1 gram or 1 gram, which is 1,000 milligrams of super concentrated fake epi. And then we put that into a liter of fluid. So here we are then diluting that 1,000 times. So then this red fluid right here represents 1 to 1,000 epi. So I've taken that 1 to 1,000 epi. This is what we would consider in the hospital super concentrated, and it's what comes in these vials like this. So a single milliliter of 1 to 1,000 epi is very strong. And so, we may not even give that much to a patient if it's being given. In cardiac arrest, they might give 1 single milliliter of 1 to 1,000. Or we may give a third of that for like an anaphylactic reaction, something along that line. So this is still super strong. And we can also kind of think about this like we did with the percentages, but it wouldn't have been, it'd be way too confusing, but 1 gram per milliliter that has been diluted here 1,000 times, then instead of a 1%, this would be a 0.1 or 1/10% concentration. But so this 1/10% is still super concentrated. So we're going to have to dilute that even more. And so this is literally 1 milligram per milliliter. And that's strong, strong, strong. 1 milligram per milliliter is something that's super strong. In other words, we would never see this in the hospital setting. We're going to see this, and it would be a very careful use of this 1 milligram per milliliter or 1 to 1,000 epi. So if we take a milliliter of this 1 to 1,000 and then dilute it 100 times into saline, that's going to give us 1 to 100,000 epi. Now, so this is more along the lines of what we're going to inject. So if you go back and look at how dark this original syringe was, and then lighter, and then this is essentially the same thing as 1 to 1,000. We take that 1 to 1,000 and we dilute it again to get this 1 to 100,000. When we use local, 1% local with epi, it's going to be 1% lidocaine with 1 to 100,000 epi. So this gives you an example of how much less concentrated that is, but we would need this to be injectable. What's in this syringe is not something we're going to inject from the back table. We're not going to inject 1 to 1,000. That's going to only be used topically, and we will have topical adrenaline or topical epi that is 1 to 1,000 that we might place on a little pledget or a little piece of gel foam and use it topically for anticoagulation to help shrink the vessels, but we're never going to inject 1 to 1,000 from the back table. We will inject with our local 1 to 100,000. So very much has to be weakened or you get too much of the epinephrine. The 1 to 100,000, they're getting very weak. The 1 to 1,000 is 1 milligram per milliliter. So the 1 to 1,000 is 1 milligram per milliliter. I apologize for the interruption there on the phone, but trying to remember about where I was when but 1 to 1,000 is 1 milligram per milliliter. This 1 to 100,000 would actually work out to being a 0.0 1 milligram per milliliter. So you see how small this is. That's the reason we're using this ratio, this 1 to 1,000 ratio. This is a very small amount of a super concentrated drug, and whereas this little bit of amount is what's injectable for us. And if we were going to inject this 1 milligram per milliliter, that would be in an emergency situation and would be, maxed out at about a milligram per milliliter. I mean, 1 milligram, or only 1 milliliter, that being necessary, or even a third of a milliliter. So this is very strong, and to get to what we would inject, 20 milliliters of would be, very much smaller. Now, if we're going to inject more local, we're going to make it even less concentrated. We're going to dilute it more. So, like if we're injecting in order to for like a facelift or something, if we're wanting to mass an area, we're going to do that with like a 3% lidocaine, and that would be 1 to 300,000. So even a lot less concentrated on the epi, because we'd be injecting more of it. And so if we're going to inject more than 20 milliliters or so, then we're going to want to dilute it further. All right, now that we've looked at this, how these are supplied, we can look at a couple of things here that will help us to be able to convert our medications. And the two things that's going to give this assistance to us is utilizing both ratio and proportion. Ratio is going to be, we're going to use that. And like I mentioned, as far as showing the epinephrine, the 1 to 1,000 equals 1 over 1,000. With proportion, if we've got both things the same, then we can look at it as A over B equals C over D. Now, this is going to be real similar to desired overhand that some of you may have used as far as looking at a simple math calculation when when your concentration is the same. And so if you've got something that's in a standard amount, such as you want, let's say, you want 400 milligrams of ibuprofen, and they come in 200 milligram tablets, then we are going to need 200 divided into that 400 will go 2 times, or 2 tablets. All right, and we could do that also in milligrams per milliliter. If we needed 800 milligrams, and we've got 100 milligrams per milliliter, and our unit then would be the milliliters. We could divide that out and see that we need 8 milliliters of that 100 milligrams per milliliter in order to have that amount. So kind of just a simple way to look at it. Where it gets more complicated is when we're changing the concentration. So we got a concentration to begin with, and we're going to convert it to a second concentration at a second volume. So you're shifting both volume and concentration. And with that, we can use the standard dilution equation where C1 is our concentration 1, C2 is concentration 2, V1 being our volume 1, and V2 being our volume 2. So it is C1 times V1 is going to equal C2 times V2. And then we're going to end up solving for the one thing that we do not know. So to give an example of this, and then we'll do some more, I always write down my equation to begin with. And I like to think about my left side of this, and you can do it either direction. It works out mathematically either way. But this left side is, I'm going to think about what the circulator has. And this right side is what I'm wanting on my back table, or what the scrub has. And so that way it helps me kind of keep it separated, especially if I look at a word problem, or we got it in a word problem sort of format. And so let's do one of these with the example I gave earlier with heparinized saline. So let's say that the circulator has concentrated or a stronger heparin, and the concentration on it is 1,000 units per ml. So we've got 1,000 units per ml. And what we want to have in the scrub roll is 10 units per ml. And we want a volume of 500 mLs. And so what we do not know is how much of this strong heparin we need to add to our 500 mLs in order to get the concentration of 10 units per ml. And so we're going to solve for the volume 1, or how much the circulator will dispense into our known 500 milliliters to end up getting a concentration of 10 units per ml. And the circulator is starting with that 1,000 units per ml. All right, so we've got 1,000 times V1 equals the 10 units I'll put units over here too, so we do not remember that, or do not forget that. 10 units per ml. And we're going to be multiplying that over 500 times 500 mLs. So that equals then, our mLs drop off here, that equals then 500 times 10, which is going to equal 5,000. We've got the 1,000 times V over here. So then we can divide both sides by 1,000. And find out that our volume 1 is 5, which would be the 5 mLs. So the circulator then draws up 5 mLs of this 1,000 units per ml and dilutes it into 500 mLs in the on the back table. Then that will equal 500 milliliters of 10 units per ml. So this is just one example. So what I'm going to do now is the 10 math questions that I gave for you to work out, is I'm going to work those out individually in separate recordings and upload those separately. So this kind of just gives you the introduction to where we're going with that information, and hopefully help you kind of understand better the different types or different ways the medication is supplied, and why it's important to understand those, to understand the different concentrations of the medication, and how easily that could be confused if you did not understand how they were supplied. All right, so we'll get some math questions ready for you.